everybody, and welcome to this ECIST Bitesize podcast. My name is Erika McGinnes, and I'm an improvement manager with ECIST, which is the Emergency Care Improvement Support Team. The focus for the discussion today is improvement in ambulance handover, and I'm joined by two colleagues from West Yorkshire who are here to share their improvement journey with us. Helen and Stefan, would you like to introduce yourselves?
Hi, I'm Helen Collins and I'm the Deputy Director of Operations for Mid Yorkshire within the Acute Care Division, and Emergency Medicine comes into that portfolio.
Hi, I'm Stefan Francovia, Area Operations Manager at Yorkshire Ambulance Service for Wakefield area and still a paramedic.
Thanks very much both and welcome. Before we start, I guess it might be helpful to provide some context for our listeners. So it's fair to say that colleagues at Mid Yorkshire and the ambulance service came together in April 2021 to explore how they could jointly reduce handover delays. There are, of course, various approaches that people can take in this respect, but both organisations felt it was helpful to complete what is known as a Rapid Process Improvement Workshop, or an RPIW for short. And this is a core part of both organisations' quality improvement approach. Which I guess brings me to my first question. Stefan, what problems specifically were you trying to solve when you got together?
The main problem was about handover delays, and as we know, there's national handover delays throughout the country at various key hospitals, which can create huge and significant problems for ambulance services in delivering a safe service. So myself and Ellen met regular best part of last year throughout up into winter period, looking at various small scale initiatives that we could put in place to improve this quite locally, and that was the driver really then for part of the RPIW and moving forward with that. Just to put some context in behind that, on an average at Yorkshire Ambulance Service alone we can lose between 500 and 600 hours a day over the 15-minute period through our key hospitals that we serve. So again, that was another driver, and then there was the staff experience, patient experience and outcome as well that were associated with this driver.
Thanks very much, Stefan. That's really helpful. Helen, it's fair to say that this was not a quick journey of improvement. We are talking about work between both organisations that started longer than a year ago. So if you had to describe what that year and a little bit longer involved for both your teams, what did it feel like and what did it look like?
I think initially we decided to do it in April 21 because the impact on patients, we were having significant clinical risk. And I think the initial phase, you're right, Erika, it was a journey, was actually understanding what the problem was. And throughout that, from April to winter period, there were mainly three key areas of the journey. There was understanding what the problem was, and that was about the joint collaboration of Steph and I, so Yorkshire Ambulance and Mid Yorkshire, actually going some deep dives about the challenges associated with ambulance handovers, so dispelling myths. And we did integrate some of the methodology within that period. There was then an engagement phase, and this was quite pivotal. And the engagement phase was from both providers, but it was about getting staff's ideas, staff challenges, and also the engagement into the operational standards framework and plans that you've got. So it wasn't just about the process, it was that wider system approach as well, but from Steph and I's perspective. And the last phase was about the co-production and the staff integration for ideas and trying and testing areas of change to make the process better for, absolutely, like Steph says, the patient, reducing the risk and staff morale as well.
Thank you. And we will come back to the staff engagement conversation because you're absolutely right. That is vital and fundamental to any process of change. But before we do that, Helen, could you briefly describe for people listening what an RPIW involves?
So an RPIW is a week-long event where teams from any single staff member, patient that impacts on that process come together. So it has a very tight scope. It's called inch wide, mile deep, where you have your start and your end point. There's normally a 12-week observation period where all elements of the process are observed using different tools. You engage staff to find out what they feel the challenges are, and you observe and measure time where the challenges are, and that's really helpful within that period to dispel some myths and actually create what they call a value stream map to identify what adds value and what is waste. You come together as a joint provider, work through the week and test change, so it's live, but also measure at the same time. So by the end of the week, you've got a suite of actions that go onto what's called a newspaper that then you test throughout the periods, and then you have a report out at 30, 60, 90 and 120 days to see how those improvements have gone.
Thank you very much. So clearly, although the week it kind of feels fairly short, there is a fairly intense amount of work that goes into that to get everything lined up and right. And I guess that kind of counts for both organizations. Stefan, a question specifically for you. We talked about, I guess, the scope being inch wide, mile deep, and of course, even the ambulance handover process feels much bigger than that. How did you go about deciding which bit of the process to focus on specifically?
The main areas to focus on were from the mapping that we did up at the ED department. So we had quite a number of RPIW staff working within the department, quite a number of weeks looking at the whole process from the point of arrival of an ambulance to the point of coming clear. And they were continuously mapping the process, interviewing staff, interviewing some patients in order to get a patient experience and looking at the journey throughout, right to the point of the crew coming clear. And by doing that, then it allowed us to pull a lot of data and information together to support the week's RPIW in looking at the main areas of improvement, or the main areas that we could focus on improvement. And that did bring out a lot of cost saving as well, certainly improvements on patient experience, but certainly a lot of cost saving and waste management throughout that process as well. And I think supporting that, we involved the staff from both Mid Yorkshire and Yorkshire Ambulance Service. And when I say staff, I mean operational staff in this journey, and they were also involved in the week RPIW in supporting some of this change.
That's great. So I guess there's two parts probably from the process that we might want to explore. So Helen, you talked briefly about staff engagement, but how important was that to the overall process, would you say?
For Steph and I, when we've debriefed and reflected on the RPIW and the journey that we've been through over the last 8 months, it's crucial. It's a real foundation stage, and staff work in this area within the emergency department day in, day out. You know, the crews attend all the time, so they are absolutely the right people to know where areas of change are, and part of Steph and I's role is to support those changes. So you get ideas from staff, but not only that, is data gives you one element, so you can have data, but actually it's the how does it feel for staff, so that quality metric. Because whilst one area on the observations might look like it's really well, it actually may be exhausting for staff, or they may have areas, a small thing like a printer, that would really help improve the processes. Yeah. So you get the ideas. You also, it's about all areas of staff. So we had the consultants. It's about that communication about what's happening, so everybody feels involved, everybody gets engaged, and then when you come to test things, you do it as a team. And when I talk about team, it's improvement, yes, and Mid Yorkshire. It wasn't working in a silo. So how did Mid Yorkshire feel when they entered? How did Yass feel when they entered Mid Yorkshire, and what did they observe? Because sometimes Mid Yorkshire clinical staff might not see what Yass see, and they have a different perspective. So that is one of the successes of the journey, was about staff engagement from all providers.
And I think just on the back of that, Erika, if I could just mention,
of course.
On back of what Helen's just explained there, is I think that's been very instrumental and continues to be shining the light now, certainly from a Yass and a Mid Yorkshire Trust, because the engagement communication now is better than it's ever been within the department with all staff at all levels, and we're continuing to see that now. And I think that's certainly supporting the significant improvements we've made throughout the journey, and will hopefully continue to do so going forward.
Absolutely. So I guess this is also perhaps a question for both of you. Outside the process of the RPIW, how did you go about then, I guess, sustaining that commitment and engagement from the wider team? Because of course, there is an absolute value in the core group of people involved, but for the process to work, you need a much bigger group of people to support that. So did you do anything in particular with the wider groups of teams, I guess, both in the emergency department, Helen, and also with your ambulance crews, Stefan?
Certainly from a ECIST perspective, we've done quite a lot of communication in regards to that. We've put things out on a social media in regards to the work that we've done. We've also put information out on investment days with all those operational staff. And it was certainly led from the front anyway, so the staff were involved from day one in regard to the RPIW, from the very initial stages of where we were mapping it all out to spending the actual week supporting and delivering the RPIW, and some staff continue to do so today in regards to supporting the department, spending time in department from both a ECIST perspective and a Mid-Yorkshire perspective. Do you want to add anything, Ellen, from Mid-Yorks?
I think ours is very, very similar engagement events using Facebook displays to actually, but it's wider for Steph and I, because obviously, you know, we both come as a package together, but it's that operational input in relation to Steph and I, the regular escalations and the feedback to operation planning cycles for YAS and Mid-Yorkshire. It feeds into our daily brief and our operational meetings like the management team meetings, so that it's the wider impact and understanding of the test of change and the impact, and then also from the executive team as well, you know, so their understanding of what's happened in Mid-Yorkshire, so that they can showcase improvements, but also put positive challenges where areas need to be, you know, improved.
I guess what you've both kind of said is that actually in these cases, especially saying things once is not enough, and you need to keep that message going and alive for a considerable kind of period of time. The other element I thought it was important to touch on was the observation. So you both talked about investing a significant proportion of time in the run-up to the RPIW, just understanding what was happening. How important is that part to the entire process, would you say, Helen?
I think it's a really important part, because when you work in an area or an environment or a role, you make assumptions, and we brought the Kaizen promotion team in and also the YAS improvement team to do independent observations about actually what was happening, because staff assume they know what's happening, and actually sometimes it helps challenge those, well, there's no wheelchairs. Well, there is, because it's in that place, and we've observed between the hours of 9 and 2 there is, because actually at 6 o'clock there might not be. So actually it's really helpful.
Stefan, was there any particular element of that observation that was helpful to Yaz, or would you agree with kind of Helen's comments overall?
I agree. Yeah, I fully agree with Helen's comments that she just made there, and I do think it was instrumental, and I think it unearthed some problems, issues and concerns that we probably didn't know about, and also our staff didn't know about, that were working on the shop floor, which were quite interesting to see and for us to work through then as part of the RPIW week.
That's great. A core part of the methodology, Helen, is identifying waste. So are there any wastes that you found out that perhaps surprised you or that you hadn't anticipated?
I think the environmental flows was the biggest thing for us, Erika, because obviously we were in a COVID pandemic when things changed, and actually when you looked at the infection pathways, there was some real interesting historical elements to it that we could have improved a lot sooner, that, you know, impacted significantly, well, positively, really.
Anything you would want to add, Stefan?
I think from our perspective, it's been more the collaborative working and approach to all this, which has been significant. And we've had a member of staff working within the ED department 5 days a week, who's been supporting a lot of this change, and has been an integral part into the communication, escalation, identifying problems, and supporting certainly the ED staff and our staff within the whole process. So what's come out of the RPIW has allowed us to, want for a better word, to keep the foot on the gas with the team that we've had up there doing this piece of work, and certainly going into winter where we know it's going to be exceptionally challenging. We really do need to keep that going forward.
I know that you have seen some significant performance improvements as a result of the hard work both your teams have put in. And I guess, Stefan, just picking up what you've just mentioned there with an eye towards winter, is there anything additional that you will be doing to kind of maintain that sustainability as we head through what we know is likely to be a more challenging time?
We've got some trust-wide initiatives that we're putting in place, one being several Halo resources that we're just recruiting into currently. That'll be supporting certainly as most challenged EDs within Yorkshire at peak times. And we'll be also looking at probably mirroring some of the work that we've done as part of the RPI, or we are doing mirroring some of the work that we've done as part of the RPIW at some of the other most challenged trusts as well. And just when you touch then on a performance perspective, mapping it against the same 3 months last year, we've seen a 10% improvement within handovers of ambulance resources at the ED. And to put that into numbers, 2021 was sitting just over 20 minutes. 2022 for the same period of time is sitting under 14 minutes, which is significant.
An absolutely big improvement in the context of the lost hours conversation, which I know is also becoming very prominent as we kind of head into winter. This brings me nicely then to my last question, and it's a question to both of you. There will be, I am sure, many managers up and down the country right now thinking about where and how they can improve their handover performance. If you had to offer any advice to them, what would it be? And we'll start with Helen, perhaps.
The piece of advice that I would give, it's a journey. It's a collaborative journey, and the importance of triangulating staff engagement of methodology and working together as you can't underestimate that.
Thank you. Wise words for sure, Helen. Stefan?
Mine would be a multidisciplinary team, both from the acute side and also from the ambulance side, to work together extremely closely on this, and also look at the risk. Where is the greater risk? Is the greater risk out there in the public, or is the greater risk sat in the department in different areas?
Thank you both very much for your time. We've come to the end of our podcast today on ambulance handover performance. I hope you found that useful, and huge thanks to both Helen and Stefan. We look forward to seeing you again very soon.